Mark, are you ignoring me?
Okay, Christy, I have the broadcast started. You can get started.
Okay, we'll call the meeting to order. Everybody have a chance to look over the agenda?
Yeah. Yep.
Okay, need a motion to approve?
I will, Sharon. I'll second.
Okay, all those in favor?
Aye.
Opposed? Okay, agenda approved. And the minutes from the last meeting?
I would move to approve the minutes from the last meeting.
I'll second it.
Okay, all those in favor?
Aye.
Opposed? Okay, minutes approved. Palace Transit contract.
In the packet are the updated Palace Transit contracts that need to be approved. There were no changes.
You just needed a motion for approval. I would move to approve those contracts.
I'll second it.
Okay, all those in favor?
Aye.
Opposed? Okay. That's all for that one?
Yes. Yes.
Okay, transit asset maintenance plan.
Also in your packet is the transit asset maintenance plan. And that was put together, the template was put together by the state DOT. It's something we had before, but with Jolene leaving our operations, we had names in there. So where you see where it says transit supervisor and community services director, we actually had names in there. Okay. We removed the names and just put the titles in so that we don't have to approve this every time that there's a change. So this is the updated plan with titles instead of names.
So we need to approve this as well? Yes. I make the motion to approve.
I'll second.
All those in favor?
Aye.
Opposed? That was easy enough. Okay, transit operations.
Okay, I just kind of want to give you an update on what we are doing for our operations for transit. We are still operating the dialysis-only bus. We are making sure we clean after we have passengers, after every passenger, and we do a deep disinfecting at the end of the day. We are still highly recommending mask usage. It's about 99.9% use. We do provide masks for those that don't have it. Our ridership is going back up slowly. We still have the clear shower curtains separating the driver from the passengers. If there is a person who is getting COVID tested, then we find out after that passenger is being COVID tested, the driver is quarantined, self-quarantined until the results come back. So that way the driver can't pass it on to other passengers. Because our drivers, even though we're separated by that clear shower curtain, for wheelchair passengers, they come in close contact with their riders. We did have an instance recently with a dialysis patient who had to be COVID tested, and we had to quarantine that driver because it was a wheelchair passenger. So, I mean, it's something that is happening. I'm sure it will continue to happen. We have meetings with transit providers across the state trying to figure out what is the best and safest way to do this. There is only one transit system right now that is transporting COVID passengers to get tested. It puts a struggle or a strain on our staffing when we have to do that because that driver has to be quarantined. So if a person is undergoing testing or is waiting for results or has tested positive, we don't transport them right now. And that's basically what they're doing statewide except for the one transit agency. And that's because we don't have the staff to quarantine every time this happens.
Right.
I guess if you have any ideas or input what you think we should be doing. I know, Whitney, I'm glad you're here, because I know it's important to continue to take these people to dialysis, but we can't put our staff in quarantine every time we have to take a person who is possibly tested positive. So I guess your ideas, opinions, I'm looking to you as experts for help.
Well, I know that dialysis is, or our dialysis, I can't speak for Dakota, but, they are doing a lot of education of those patients as far as you really shouldn't be going anywhere except for home and dialysis.
Mhm.
And some of those people do have, like home workers that are coming.
Can you pull your mic closer?
Yeah. Yeah, so we're just.
Is it on?
A lot of.
That would help.
That's much better.
Okay. A lot of education with those patients on social distancing and making sure that they're trying not to go anywhere except for, home and dialysis and, having other people, family members do their grocery shopping and things like that. And my hope is that if they are positive, they aren't coming in, and trying to utilize them up anyway, but, other than that, other than just a lot of education, I don't know, I don't have really any information because, so that's what I know.
Anybody else have any input, what we should be doing, shouldn't be doing?
I assume if they've got home workers that are taking care of their groceries, they probably could get them to dialysis. You're not talking in your mind. I'm just asking if the ones who are their home or family members are taking them to dialysis in the absence of our not being able to.
Yeah, I don't know, and I think those that are in wheelchairs, that is more of a barrier.
It's difficult, yes.
I can't speak to that, I can get some more information on that.
I just know that they can't abruptly end their dialysis for whatever.
Jessica, I have a question. So you're quarantining the driver until you find out the result of the test, is that, because that's what we do.
That's correct.
Okay, so if you find out it's negative, they can go to work.
Correct.
Yeah, we deal with that on a daily basis. It's a pain in the butt.
And it usually takes about 2 days to get a test back.
Yeah, we're waiting on somebody and, everybody's crapping their pants and then everybody celebrates. So we haven't had anything turn of it, but I totally understand what you're going through. I just can't think of anything you could do different. I mean, I'm just comparing it to what we do.
Another thing that we are talking about is school starting back up again. As we all know, right now we do a really good job of spacing people out, except for there's the kids club group that rides. They don't space out, but they're with the same kids all day, and we do clean after every ride that we give. The kids are going to be in close proximity for the school because our buses only hold so many passengers. So these are things that we're going to have to explore, think about, and.
They should be wearing masks, right?
Correct.
So, they're going to wear them in school, so they better have them on.
And what we do is, I know with our other bus company in town, they bring all the kids to a gathering and then they separate them and they go their different routes. We will keep our kids, so if they go to LBW, we will keep those kids on the same bus. So LBW students will stay with LBW students. Longfellow students will stay with Longfellow students.
That's good.
Very good.
So on and
That's
so
good.
forth. So we won't be intermixing schools.
Yeah, that'll be good.
We have in the past picked up at, John Paul and
Mm-hmm.
Mitchell Christian, but we're going to try to keep them separate all this
Yeah.
year. That's about all I have for updates, unless anybody else has anything.
Okay, go on to the next one then. Frozen meal.
I'll let Amy talk on that one.
Okay, we just had placed, it is on. We had just placed an order last month, and we just got it yesterday. And the problem is the company we get our meals from, they are out of a lot of the meals. For all the meals we get, they only have about 12 meals that we usually use.
I'm on a Zoom meeting here, hang on.
So, yeah, the meals are still going good. We were out of like about 8 to 10 of them before. And now, like I said, right now they're limited. They don't know when they're going to get their supply back in. So we're pretty much limited just to a few meals that we can even get anymore, but we still try and keep as many as we can as possible.
So now, how can we get the copy of those meals to give to somebody? I've had different ones ask me.
I can't hear who's talking.
So that's Louise, and she's asking how to get a copy of these meals to give to people. Just have the people call our office. We can email it to them. We can mail it to them. Just have them call us, and we can get them the information.
Okay, because I've had different ones ask what meals are available.
Yep. Right now, since we did just get our truck, we are only out of 3 of them since they didn't come in. So for the most part, right now, we have most of them except for 3.
Okay.
So it is available on the city website, and they can call.
And that is mainly because the company we order from, they can't get the food to
Right.
make these meals.
Like a lot of other stuff, yeah.
Anything else on that one?
No.
That was it.
What? Okay. CARES Act for nutrition.
Now, do they pick those meals up at the drive-up window now, or what?
Yes.
Okay, thank you.
Okay, the CARES Act for nutrition. We received the CARES Act funding for, was it March and April? Is that correct, Amy? We got double the meal rate for March and April. In June, they went back to the regular rate that we received before, which to us made no sense because June is our new fiscal year, and our new contract gave us a 2% increase. So we got 2019 funding in 2020 funding year, which we don't feel is right that they did that. We should at least got our 2% increase, but we didn't. The state did put together, because there is some leftover money after the double funding, we feel there should be more funding than what the state is providing us. We are talking to the Department of Health Secretary and Deputy Secretary and the division head to see where this money is and what we can do to get it. They did put out a South Dakota COVID response funding survey, and it's kind of a application for this leftover funding. I have issues filling it out. This is, okay, so they have the leftover money. It's not enough supposedly to give everybody double rates for the meals, but there is enough money that they'll give out to these programs if they need it. But the reason I have issues filling this out, yes, it's free money and I want to fill it out because it's free money, but it says at the very top, and I have a problem signing my name to this when it says, if your agency is in need of financial support to maintain viability of your program during this time, please commit the below application and submit. So, if our agency is in need of financial support to maintain the viability of your program, I honestly cannot sign my name saying that our program can't operate without this money.
Right.
Yeah.
They tied your hands, right?
Yes,
Before you even,
but I don't like not applying for free money.
yeah.
And with the money that we did get in March and April, we gave all our contractors extra money because all their expenses went up with food. So that's where we did do the money. The contractors all got the extra money. And we also had all the to-go expenses for each place, and we paid all those too.
And we really, that 2% is not going to be enough to cover us for our added expenses right now, because we are still doing the to-go meals and all these added expenses that we need.
Then the answer is yes. Then the answer to that statement is yes.
In the viability?
You could not keep going, right?
As of now, we can, but to make it through the year, we can't.
Yeah. Then, yeah.
Yeah. See? I
Spell it
got
out.
two little things on my shoulder here.
I know. But it just seems to me that, they were just.
So the 2%, that we're not going to get that back, or are you going to look into that one?
We are not getting the 2% for June. It will start for July meals. It should have started because our new contract, the beginning of the fiscal year for nutrition, is June. We should have got it in June, but for some reason, nobody did.
No.
Oh.
That's why the state nutrition providers are meeting.
Ask for back pay?
No,
Why? I mean, that's what I would do.
because it's,
We got our 2% on our rates starting in June, and we go through the state just like you do.
because they amended our contracts, and they haven't given us a new contract yet for the 2020, 2021 operating year. They are behind on giving us our contracts.
That would not make me happy.
Agreed. The nutrition programs across the state are not happy.
Yeah.
Yeah, well, I guess I'll stop complaining.
So I suppose I would like your approval to apply for this funding if you feel that we need the financial support to maintain viability of our program during this time.
I would say yes. This is a whole year of planning and yes.
Yeah,
I would say yes, we should apply.
you may be able to be viable for another month, another 2 months, but for the year you
Right.
don't have.
We don't want to lose the program when maybe the virus is gone, so. Or have to start from scratch.
So Sharon motioned, we would just need a second. Christy Whitney seconded that.
Oh, okay, sorry, I didn't hear you. Okay, all those in favor?
Aye.
Right.
Opposed? Okay, motion carried. Okay, is that all we have for that
Yes.
section? Or just, okay, reopening plan.
Okay, so last night at 4:55, Commercial Asphalt showed up at our parking lot and finished our parking lot finally.
Yeah.
The engineering department traffic was over at our parking lot this morning, marking for lines, and they will hopefully be placing lines soon. So I think we should be good to go by Monday.
Hopefully.
Hopefully. So I guess my question is to you, are we all okay for opening on Monday, and what phase would you like to open at? I have included, I know Amy emailed this out.
Yeah, let's talk about
These
this.
are the most updated South Dakota Department of Health COVID information for Davidson County. On here, we have Davidson County, this was as of this morning. I waited till this morning to print these out. Davidson County had the 14 active cases. The second page shows just Davidson County's trend line. As you can see, as of right now, our trend line is going up, not down or staying stagnant. And then I included South Dakota's cases on the bottom of that page. And then I broke it down on their website to go by their ages. So as you can see, the active cases are mostly younger people. The highest age range is 20 to 29, and most of them being male. But if you go to the last sheet, I broke cases by age range, and I went by the active people who are hospitalized. And right now, most of the hospitalized people are in the 50 to 70 age range. And then I went and did cases by age range and deceased. And those that have passed are in the older 80 plus. There's 40 some in the 80 plus age range. I just want to give you that information as you talk about the reopening plan.
Anybody have any suggestions?
We would be moving into this phase 2, right?
That's up, oh, sorry, that's Wendy. Can you move your microphone closer? Right now, we could be moving into the phase 2 if you're okay with that, or if you want to go to phase 3 right away and skip over phase 2, we can do that. This is all up to you guys.
So it looks like phase 2 would involve opening the main room, South Activity Game Room, and the deli with no, like activities, no planned activities.
No planned activities, yes. People can come in and do what they want to do, but there's just no planned activities. I'm not gonna lie, the biggest concern I've gotten from people on phase 2 is no coffee.
Nope.
You're kidding.
That's our biggest concern on our phone calls we've received.
I'll say we have coffee pots at home.
But they can't bring it in.
They can't bring it in. Oh, okay.
Are they allowed to bring in their coffee cups?
No.
So they can come in and eat and just kind of hang out. Okay.
Are they gonna be required to wear masks?
Not required, strongly encouraged.
Okay.
I don't know anybody else, but our numbers aren't going down yet. I think phase 2 is a good place to start.
Have you thought about like temperature checks or anything like that?
We talked about it, but I don't know we can legally do that because we are not a medical facility.
Well, they're doing,
We can do it, we do temperature checks for employees, but on the people that visit our facility, no.
But you could.
yeah,
Yeah.
I'm sure you could. They do it as,
Lots of restaurants do that throughout the nation, even customers. As you guys see now, Menards and Walmart are requiring masks. You cannot get in the store if you don't have one. And that is going to spread throughout other businesses. And it should.
But those are privately owned, where this is a governmental.
I'm saying, I don't know for sure, but you could do temp checks, I think. For what?
HIPAA.
I don't think that has anything to do with it. When I go, there are a couple places I got my temperature checked, I just can't remember where it was. But, you know, can you have them answer a questionnaire, or we have to do that every day?
Right, can you ask, just, at the door before they come in, you just ask, have you been exposed, have you had a temperature in the last 24 hours?
Have you traveled?
We could add screening questions to phase 2.
You could check
I
with,
can send you what we use if you want.
and you could check with Justin Johnson to see you said that we can't legally do it, I'd check with him. And if we can,
Yeah.
do so.
yeah.
Good idea.
Exactly.
I think if there's no name associated with it.
Use the mic,
and-
get closer to the mic.
Yeah.
I think if there's no name associated, you're just getting the temperature and yes or no coming in, and there's no record,
Because we do the screening questions for everybody that rides the bus. They don't get a temperature check, but we do the screening questions.
Okay.
I would say with our cases not going down and with the population served at the James Valley Community Center, I wouldn't move. I wouldn't want to move forward to phase 3. I don't know about everybody else, but, that's just my thought.
What's the actual differences between 2 and 3 then?
Phase 3 has organized group activities.
Mhm.
It opens up more rooms and allows more people in the building at a time.
Yeah, we're not ready. We're not ready.
We're not?
No, we're not. I mean, I'm ready, but I don't think, I agree that with the cases still going upward, and they're going to continue to, I think.
What was said in between that? It was all muffled out for us after Whitney.
I was just saying that I think we should do no more than phase 2. We are not ready for phase 3.
For how long?
I don't know. I
Well,
think that
no
becomes-
one can answer how long.
Right.
If it keeps going up?
If you do phase 2, that's stretching it to me, but that's fine. But you can't go any further than that, but you gotta understand where I work
Yeah,
and what we deal
exactly.
with every day, so,
Yeah.
Exactly.
you know, we have no idea when we can let families pick up their kid. If someone calls and say, well, when can you do that? We don't have an answer, because I don't know when COVID's going.
Right.
Correct.
I also, just at my apartment building, a lot of people that just don't take it serious enough, and if something's open, they're gonna go. If
Yeah.
it's not open, they're not gonna go. And that's everywhere, so whether it's the stores or, you know, the movie theater or whatever, so that just makes it a little more, you know,
Yeah, which
concerning.
we heard that the movie theater is opening, so that.
Right.
I know, I'm not happy about that.
The more
My
things
husband
that
works
open,
there.
yeah, the more things that open, the more problems it causes for us, because like you said, people wanna go and they're gonna go. And you can't stop people from doing things on their personal time, you just hope for the best.
Yeah.
Right.
You do have those seniors that are not germ conscious. Just for an example, the other day, I had a lady that came and bought a dine card, so I went outside. She wrote her check, licked all her fingers, tore the check out.
Oh.
Oh my God.
Yeah. I mean, how do
Oh, I'm gonna stop breathing.
Yeah.
Yeah, I mean, we have a 2-hour meeting every day. I'm just telling you, it's awful.
Would we need to have a motion to amend this phase 2 to have the screening involved with the temperature check if just the attorney indicates that we can do that legally? I would make that
Yeah.
motion for the.
I like that a lot.
Phase 2.
Now, one other question too, now, if we go into phase 2 and next week we have 20 people with COVID in Mitchell, can we go back?
That was going to be my question.
Absolutely, we would have a special board meeting.
Okay,
Good.
just making sure.
So I think there's 2 different things. I think there's the motion to amend this current plan, and then I think we would need a separate motion for implementing it, correct?
Yes.
Right.
Yes.
So I make the motion for amending it to include screening questions and the temperature check if the city attorney indicates that we can do so.
I second it.
Okay, so what if he says you can't do that? Then what happens? It's not in the motion.
It is in the motion because she said if it's allowed by the city attorney. So if we don't, we just don't do it.
So the motion means that it will open as phase 2.
No, the motion is
If
still.
the attorney says no, it's still gonna open.
No.
No, the motion-
Motion's not dealing with the opening. I'm only making a motion to amend the current plan, Mark, just to clarify. We can deal with the opening in a separate motion. Does that make sense?
They want,
Not really, but that's okay.
she wants to amend that to allow for that.
Okay, so we had a second on that.
I'll
All
second.
those in favor?
Aye.
Opposed? Okay, so the screening questions and temp checks will be added to our plan, phase 2, as long as the attorney approves it.
Now we have to decide whether or not we
Right.
want to go into phase 2, correct?
Do we have people chomping at the bit to come and eat? We do. Okay.
Right.
Will you have the table separated? Okay. Will you have a maximum amount of people that can come in at a time?
It's in phase 2, how many are allowed at a time?
Okay.
And how many are allowed at a table too?
I have a question. Can you explain how that would look like? I come in to eat and someone brings me my food. I don't go through a line. I'm just thinking of a buffet thing.
Yep, that's all in the phase 2. Meals will be dished and delivered to the participants in the table.
I don't have it in front of me, sorry.
Yep, well, we will dish and deliver the meals to the tables.
Perfect. That's what I was hoping. Thank you.
It'll
Now,
be,
when they call in to make the reservations, like, say this morning, are they gonna be required?
Is that Louise?
Yeah. Are they gonna be required to tell a time that they're gonna be there?
Yes, so they'll be required to say if they want to eat at 11 o'clock or 12 o'clock, because we're only allowing so many people to eat at a time.
How many, 70?
No, 20.
I thought the car.
or if they want to take out.
Sounds good, Jessica.
Yeah.
What if they don't have a phone?
They have to call in and reserve meals now anyway.
They have to call for reservations.
They have to call the reservation.
Yeah, they've always been, you've always had to call for reservations by 8 a.m. that morning.
The only difference is now they have to pick a time they want to eat, if they want to eat at 11 or 12.
And then we just have to keep track, and so that certain time, don't get too many people in it.
Right.
Yep.
Extra work for you guys, but be worth it. Yeah.
11 and 12, so there's 11 and 12, so they're spread out pretty good then.
Right.
Got time to
So when you're done
clean
eating,
up
get
in
out.
between and,
In between will be the takeout meals.
okay.
Okay, now when they're done eating, say 11 o'clock, the 11 o'clock people, are they required to go to another room if they want to stay, correct?
Yes, because it says in the plan, tables and chairs in the main room will be for the adult nutrition program participants only from 10:30 to 1 to allow for proper cleaning and sanitation. So when they are done, they need to go to another location.
And I know the rooms were limited. Is there place enough for them to go? Okay.
What did she ask?
If there's room for them to go.
Oh, sure.
Do we need to have an understanding that this phase 2 would go ahead whether or not the amendment that we made is approved by the lawyer?
Yes. I would.
Any other questions about phase 2?
So what would be the criteria for going back to phase one? What would be what would need to take place to go back to phase one?
This is just off the top of my head, a confirmed staff case, maybe a confirmed member case that was at the facility.
Would it require us to vote to go back to phase one?
Yes.
You could do a Zoom. Could we do it?
That was going to be my next question.
Yeah.
We would have to
Do it.
post it 24 hours about the
Yeah.
meeting, so it would take time.
I'm not sure we're ready.
So say if somebody comes in and they were positive, like a client eating, what would happen? Staff have to be quarantined?
Well, we have this new chart put together somewhere, and it talks about how long, I brought it with me.
Because if your staff has to be quarantined, then there'd be no program.
So in this new chart that I got, it says, I've been in close contact with somebody who has tested positive for COVID-19. It asks how long you've been in close contact with that person and if you need to be quarantined or not. And it asks what they mean by close contact. And a non-exposure is an exposure has not occurred under the following circumstances. When you make physical contact with a person and are wearing personal protective equipment, when you're making verbal contact with a person who has confirmed to COVID-19 or shows the signs of being sick with the unknown illness, but have maintained 6 feet or greater distance from that person. When you make verbal or physical contact with a person who does not have a confirmed COVID-19 case. So as long as we maintain those 6 feet of distance, and we don't spend a long amount of time with them, according to this chart we just received, it should be okay.
Okay, so now like when they first come in and you ask them these questions, to kind of eliminate that.
Correct, and we have barriers now, the shield barriers, the plexiglass barriers, so they can ask the questions and maintain that separation.
Okay.
Good, yeah.
The temperatures would be more of a
Talk in
problem.
them. She don't talk in the mic.
The temperatures would be more of a problem. They would have to be wearing the face shield, yeah.
The temperature check would be a harder thing to do and maintain that distance.
I don't know what it would look like, but it feels like we need to have within the plan the ability without the delay to
Right.
be able to go back to phase one. I don't know exactly what that would look like. I think of, like, if your staff have to go in
Yeah.
quarantine,
Who does the meals? There'd be no meals.
and I know there's not every possible scenario. You can't think of all the different
Right.
scenarios, but if there's certain things that just are kind of obvious, that would help with being able to go back, at least for a period of time, so then we could pull back together. I don't know.
I would assume that if this happens across staff-wide, the city would just step up and
Yeah.
close the building.
Yeah. Like they did before.
Right,
Yeah.
yes.
Originally.
Yeah, that's what I'm kind of alluding to, is there a way for that to happen?
The mayor does have the authority to make those kind of decisions.
Okay.
Right.
So are we thinking of going on to phase 2 or not, or motions or no motions?
Do you feel that if a situation arose that caused you concern, like a staff person or whatever, being positive, that your relationship with the mayor is such that you could call and say, please close our building,
Absolutely.
and we would not have to involve the board immediately?
Nobody wants to make the motion?
I'll make the motion to go on with 2, the phase 2.
Starting Monday?
Yeah, pardon me?
Starting on Monday?
Yeah,
Are you ready for that on Monday, Jessica?
We're ready.
yeah.
Okay.
You know, with the beings, we can do that, you know, if it gets, you know, bad or, yeah, where we have a leeway. I think it'd be okay.
I would second that.
Bonnie seconded it.
Okay. Now you repeat what the motion was?
Ooh,
The motion was to start phase 2 on Monday.
Okay. All those in favor?
Aye?
Aye.
Opposed? Okay, motion carried. Okay. We are to citizens input. Is there anybody sitting behind you guys?
No?
Nope, we're empty.
No.
Okay. Department reports and updates. How's transit?
That is in your packet, and the information in there is no surprise. Same trend statewide. But as stated before, our school age ridership has increased more than we expected because we have Kids Club now. And then also Head Start is preventing classes this week and next week, so we'll have some Head Start rides going on.
Mitchell Volunteer Program.
We don't actually have any reports right now. We just have had a few volunteer stations that have had volunteers. They've required masks, and you don't get a lot of volunteers willing to do it right now. We did have them do the Mitchell School packets, and everybody wore masks, but that's where we're at with that.
Not everybody wore masks.
You were there.
They were told to.
Well, I think our volunteers did,
Okay, okay.
but
Anything else with that one?
No.
Okay. Adult nutrition.
Our fiscal year started with nutrition in June, like we talked about before. So it just has the results of where we are for June. And to our projections, we were up 8 meals to our projections. But then if you look at last year, we're up from last year. So we're starting off good, even with the COVID.
Well, that's good.
Okay. Any other questions about nutrition for meals? Okay, James Valley Community Center.
I have no updates.
Going on. Anything else anybody needs to discuss? Next meeting?
I have August 13th.
Okay. as long as no big changes between now and then.
Well, hopefully. Hopefully.
Okay. Motion to adjourn?
So move.
Second.
Okay. Meeting adjourned.
Good to see you guys.
Bye.
Thank you. Okay.